One of the questions that I get asked often from people who have had bariatric surgery or people who are considering bariatric surgery is about hair loss. So, people who haven't had the surgery yet, they are definitely like gravely afraid of losing their hair. And those that have had surgery and have had hair loss, they feel really desperate and sometimes hopeless because hair doesn't seem to stop shedding and coming out in clumps. But I just wanted to try to come on here and give you some ideas of what maybe you can do to try to circumvent that a little bit. So, one of the best things that you can do starting out is number one, make sure that you are taking your multivitamins like you're supposed to. Like, I can't stress that enough. I don't know how many people that have had these surgeries that, that they come to me and they tell me they've never even heard of the fact that they should take them every day. Like, now I don't know how true that is, but I mean that's just like, if do not have the surgery unless you plan to take supplements every single day. So that means if you already know that you have a hard time being consistent with supplement regimens or medication regimens in general, bariatric surgery is something that you may want to reconsider. And I'm just being real with that. So anyway, you want to make sure you're taking your multivitamins because any nutrient deficiencies could be one of the major cause of hair loss. Number two, you may want to consider adding some collagen to your regimen. So there's different types of collagen. I tend to recommend the collagen that has all five of the types of collagen. And that's because, you want to try to get as much benefit as possible, not just focusing on one or two types of collagens. But one thing that you may want to be aware of with the collagen supplement, you can't use it as like a protein meal replacement. It's not a complete protein, and that is a conversation for another day. But collagen is a good thing to put in your arsenal. And also, besides hair, helping with your hair, collagen will also help with like maybe your skin. So a lot of times when we lose a lot of weight, we tend to have looser skin. Some people do anyway. And I'm not promising that it will totally prevent loose skin or help you avoid it, but it can kind of help maintain some of that elasticity and integrity that your skin has while you lose the weight. But you don't want to, like, realistically speaking, you don't want to lose all the weight, have saggy skin, and then try to take collagen. Like, it works better if you take it while you're losing the weight. But it can't hurt you if you take it after you've lost it. Hopefully I'm not confusing you. But it's better if you take it while you're losing the weight. And the third thing that you may want to consider adding is a high amount of biotin to your regimen. Most multivitamins will, especially bariatric ones, will have some sort of biotin in there, but you may need one with an even higher dose. Now, biotin is water soluble, so it's not going to hurt you typically unless you have some type of other underlying medical condition where your body is very sensitive to it. So those are just the top three things that I recommend. And if you have any other questions, please do feel free to reach out, leave a comment, like, and subscribe. Okay, thanks. Bye.